everybody to North Star Physical Therapy Podcast. Again, thank you so much for those who have listened to episodes before, and thank you for those joining us for the first time. So, for this episode, we are recording this in the month of November, and so we want to definitely appreciate and recognize the importance of pelvic health, not just for postpartum women or for perimenopause and postmenopause, even though that's a big thing. But for this month, we are focusing on male pelvic health. And so I'm speaking to those who are also assigned male at birth, given off on your tissues as well. So I want to be very inclusive with folks for this episode. But really, I want to extend an awareness to those that have a penis and that have testicles, that have that associated male anatomy, to say you have a pelvic floor too. It is quite amazing that if we just look at the muscular and the skeletal arrangement of the pelvis region between, I'm going to just use the binary language of male versus female, but between a female pelvis and a male pelvis, it is very similar. Yes, there's one more entry point for a female. However, the deepest layer of the pelvic floor is the same as it is in the male counterpart. There is, yes, soft tissue difference there, but I just want to really stress the fact that this muscle group, any pelvis, has major functions, including urinary function, bowel function, sexual function, stabilizing the pelvic bones, supporting the pelvic organs, no matter what's in there, as well as a lymphatic muscle pump, because there are lymph nodes in there as well. So no matter what pelvis, those are the 6 main functions. We're going to be focusing on, hey, guys out there, urinary functions. So if you are leaking urine, whether that be with the sneeze, cough, laugh, jump, running, going up and down stairs, change in position, or if it's after a surgery or after any kind of radiation or even like chemotherapy within the area, if you also have or have hesitancy. So we often see this as a quote-unquote normal part of aging. False. Okay. You should be able to relax your muscles so that the flow of urine can occur through the urethra of the penis. And if there is any hesitancy, there could be a contributing factor, a very tight or high tone pelvic floor muscle. If those that have a urinary symptom of frequency, this often is accompanied by urgency. And the last podcast I did, I spoke in depth about this, so feel free to check that out. But frequency and urgency is a urinary function that could have several factors to it. Some of them being related directly to the muscles and to the joints and to the fascia and to the nervous system in this area. If you have the feeling of not being able to completely empty when you void or when you urinate, that also could have some contributing factors of pelvic muscle, either dysfunction, coordination, weakness, high tone. Any of those things could give rise to those urinary symptoms. Also, bowel function. If you have any kind of fecal leakage or constipation, if these things are also potentially linked to any orthopedic issue like hip pain or range of motion, like a stiffness issue, low back discomfort, if someone has some kind of sciatica or tailbone pain, it could also be a part of a sexual function issue. So if, gentlemen, you have erectile dysfunction or are not able to attain or sustain a full erection, if when you either you are penetrating or being penetrated, if there are pain, any kind of pain within the pelvis there, or any discomfort upon climax or afterward, leading up to, during, or after climax. All of these symptoms that I just listed off are a part of male pelvic health. And we want to make sure that that is also operating to its fullest. How annoying is it to have to always be around a bathroom because your urinary symptom or bowel symptom is limiting what you can do day in and day out? How incredibly sad is if there is a pleasurable moment and you have to alter so much of what you do because it hurts, because it's painful. Sex should not be painful. Now, what we deem as sex is also a different conversation that we have within pelvic health. And so that is for a different podcast. But what I really want to stress is that, guys, you also have the access now more than ever to get pelvic health concerns or symptoms looked at. There are several different contributing factors that can show any symptoms. Yes. Could there be medical things? Absolutely. But within the scope of pelvic health physical therapy, it's looking outside of the pelvis. It's looking above and below the chain and the spine. So we're looking at your neck, your shoulders, your mid back, your low back, your hips, your knees, your feet. I don't know how many times I had to look at somebody's feet and how well they're supporting themselves and how the kinematics and biomechanics of what's going on in their feet affect what's going on in the hips and what's affecting the pelvic floor muscles and how they're being able to activate and help with any kind of tension within that run, or if they're too high tone, having that pressure impact of the run and how that affects their pelvic health symptom. It's quite amazing how men will go years, if not decades, are not saying anything to anybody, or they may divulge to their partner potentially, or finally say it to the doctor. When physicians or doctors are asking these questions, and especially within public health, because we tend to ask a lot of questions. We are like the master detective. I'm trying to figure out the why behind these symptoms. Absolutely. Could there be a meditation to be a reason for some of this? Yes. Could there be some other little like triggers within a lifestyle or behavior or postural habits? Yes. Could there be, yes, down to tight or weak muscles? Can there be any alignment issues? You betcha. Can there be some muscle imbalances between the glute muscles and the abs and the low back muscles and your inner thigh muscle? Absolutely. And so that is definitely something that we look into on this. I find that especially in this area, I'm in the Northern Virginia and DC metro area, we are very type A. So we are very busybody, and the amount of the impact from our nervous system and how it affects this muscle group and the symptoms specifically is mind-blowing. Almost all of my clients, I have to talk with them about their nervous system regulation. And I know there are some like big topics, within healthcare right now. We know during COVID, there was a lot of mental health expansion because of how that isolation really affected us. Now, here we are currently dealing with the government shutdown, but how that is trickling down to people's lives and how that is affecting their lifestyle habits, how that's affecting their drinking habits, their eating habits, their postural habits, and in turn, how that feeds into some of these pelvic health symptoms. And it's quite amazing how when we're able to tap into that nervous system and say, this is definitely a part of this. Like, you are also stressed out with either you being like the provider of your family, or you're a single person, or you are always, you're thinking this is how erection should be like because of pornography that you've experienced, or because some partner in the past said something to you and that just really stuck, or this perception that Hollywood gives of how things should be in the bedroom, or that you saw some really crazy off the wall statistic on like WebMD and you think that's you, or you saw something like in a forum and just went down a total rabbit hole. It's like, guys, please, please take a peek at your body. It is telling you things. If you are leaking, if you have hesitancy, if you are not able to completely empty, if you are constipated, if your sexual experience has pain with it, or it's not really present, if you are also accompanied with some orthopedic stiffness or weaknesses, as well as these pelvic symptoms. So I often pair up with some other trainers and physical therapists, actually, who maybe, who don't specialize in pelvic health, but I work with them saying, all right, cool. You're seeing them for the low back pain, but nobody's actually asked these kind of questions with you, and nobody's doing external, internal pelvic assessment on this. So let's work together. I will do that to capture that. And oh my gosh, this long-standing low back and hip pain is now gone because someone's able to do an internal assessment and treatment on you. I have a patient or a client right now that's had left hip pain for months and cannot figure it out, and has seen a trainer, has seen another physical therapist. They're doing, all the kind of like general things, but then no one has asked him these pointed questions about his pelvic health. And to see, oh my gosh, there are these muscles that are intimately connected with the pelvic floor, that we were working on one part of it, but missing this whole piece. And we started working on his pelvic health, and voila, his hip pain is gone. Now we're working on, okay, you're returning back to your wellness program and his resistance training. And we're going to be working on some of his return to sport things, because he hasn't been able to do his running like what he loves to do. He hasn't been able to do his kickboxing like he loves to do. And so we relieve the symptoms for us. We just take a step back and look at the big picture, and we assess for the other muscles. And that means, yes, having to go internal, and to be able to capture that imbalance there. To work on that, we found the why and the contributing factors to his left hip pain that was outside of the hip joint. And now, oh my gosh, hip pain's all gone. So now we can progress safely these other wellness programs, and the symptom is not going to return because now we're working smarter. So we really want to stress with this podcast, this episode, that men have pelvic muscles too, and that they need to be worked on and looked at and assessed, just like any female postpartum or any perimenopausal, postmenopausal woman as well. That tissue health, guys deserve that too. And so for the month of November, and really any month in the year, but especially for right now, we also want to recognize not just men's health, but men's pelvic health, in that there is a place for you, and there are specialists like myself that will look at any kind of urinary symptom, any kind of bowel symptom, any kind of sexual symptom, lymphatic system as well, orthopedic issue there. It's kind of like a catch-all, because your pelvis is the anchor of your body. It is the keystone of your body. There are so many things that connect. There are so many functions that happen there, whether voluntary or involuntary, a lot of automatic functions, and that a lot of them can be resolved and can build resilience in your body so it does not return. So for all you guys that are maybe kind of thinking, what's this big thing about pelvic health? Get checked out. You go find a pelvic health physical therapist that specializes in men's pelvic health, because there are some differences there in how we approach for men, because they're different either questions. There's a little bit of a different, anatomy there, but all in all, not too different. But we also want to be sensitive to the potential biases or stigmas that society puts on you that's unfair. And Here at North Star Physical Therapy, it is an open book. There is never too much information here. We want to treat everybody with dignity and respect, and that you all deserve to have optimal pelvic health. So I hope this helps for guys out there. Get your pelvis checked out. And until next time.